We are going to continue on those series of the anatomy videos. This session, as a part of the anatomy of the head and neck, will be upon the parotid gland, the anatomy of the parotid gland. The parotid gland is found on each side of the head, being irregular and lobulated. It lies below the external acoustic meatus between the ramus of the mandible and the sternocleidomastoid. It projects forwards anterior to the surface of the masseter muscle. This muscle here, this is the masseter muscle, where the gland overlap the anterior aspect of that muscle. Both glands are the largest in the body. It looks triangular in outline. Its upper border is concave and sometimes called the upper surface, while the lower pole or lower end is rounded. It weighs around 20 to 25 grams. When it comes to the borders on this side here, that diagram shows the borders of the gland. It has three borders: an anterior border, which is related to the ramus of the mandible and these two muscles; posterior border, which is related to the mastoid bursa and these two muscles; and medial border, which is related to the lateral wall of the pharynx. So that is the anterior border, which overlap the masseter, as we said, and that is the posterior border, which overlap the sternocleidomastoid, this muscle here, and medial border, which is very important to remember that it lies deeply on the lateral wall of the pharynx. This is the cavity of the pharynx, and that is the muscular wall of the pharynx. So that gland lies very deep on the wall of the pharynx, which is important clinically. When it comes to the ends, it has an upper end or upper surface, as we said, a lower end, so it has two ends, upper and lower. About the parts, in that diagram again, you can see there are three structures which divide the gland into superficial part toward the skin and deep part. That these three structures are the facial nerve, which is most important structure within the surface of the gland, the formation of the retromandibular vein, and the division of the external carotid. So that is the superficial part here, superficial to these three structures, and this is the deep part, deep to those structures here. Those structures, as I said, the external carotid, the formation of the retromandibular vein, and the facial nerve. That's very important relations of the gland. When it comes to the surfaces, it has a superficial surface, which is related to the skin, an anteromedial surface, which is related to the ramus of the mandible and structures attached to it, and a posteromedial surface, which is related to many structures, a good number of structures, as you can see over here. So when it comes to the relations, superficially will be the skin, the superficial fascia, and that superficial fascia contains the branches of the great auricular nerve over here. You can see that is the great auricular nerve. The parotid lymph nodes, superficial ones, and the posterior border of the platysma muscle. And then the deep fascia. The deep fascia, which come from the investing deep fascia of the neck, will divide at the lower border into two layers, one superficial and one deep, forming a capsule, facial capsule for the parotid gland. The anteromedial surface will be related to the ramus of the mandible, its posterior border, which groove the gland, and the posterior inferior part of the masseter with the lateral aspect of the temporomandibular joint, and more deep is the medial pterygoid muscle. While the posteromedial surface is related to many structures, namely the mastoid process with the sternocleidomastoid superficial to it, the posterior belly of digastric deep to it, the styloid process and the structures attached to it, namely three muscles, stylogloss, stylopharyngeal, stylohyoid, two ligaments, stylomandibular and stylohyoid ligaments, what we call them the styloid apparatus. Other structure related to the posteromedial surface is the external carotid artery, and that artery grooves the posteromedial surface and enter the subspace of the gland from that aspect. The carotid sheath with its contents the intercarotid, that is the intercarotid here, the internal jugular, this one here, that is the internal jugular, and here, and the last cranial, four cranial nerves, the 9th, the 10th, the 11th, and the 12 cranial nerves, as you can see over here. And this sheath is separated from the gland by the styloid apparatus, as you can see over here. Now, the parotid duct, that is the parotid duct here, which comes from the anterior border of the upper part of the gland, that is the gland here, and that's the duct coming from the anterior border. That's a good position and good specimen for the duct. It passes horizontally across the surface of the masseter muscle. This is the masseter muscle, almost midway between the angle of the mouth and the zygomatic arch. That is the masseter here. It crosses the masseter and turns medially almost at the anterior border, almost at right angle. So when it reaches the anterior border of the masseter, it curves in a right angle to start piercing a number of structures. It traverses those structures, the fat, the buccal bed of fat, the buccopharyngeal fascia which cover the buccinator, and the buccinator muscle, and lastly the buccal mucosa. The duct will end up by opening in the vestibule of the mouth opposite the upper second or third molar teeth. That is the duct over here. It may receive an accessory parotid duct from the accessory parotid gland. This is the accessory parotid gland, which may give a small duct which joins the duct of the parotid. The accessory part of the gland and the transverse facial artery lies above the level of the gland, above the duct. So that is the transverse facial, and that is the accessory part of the parotid gland. Within the parotid gland, there is many structures which we will see now, and namely those three structures: the facial nerve, that is the trunk of the facial nerve, and the number of veins which are the superficial temporal, that is the superficial temporal vein, and here, the maxillary vein over here, the retromandibular vein and its division anterior and posterior. That is the deep part of the gland here, the part which we can see here. These structures appear when you remove the superficial part of the gland. That is the retromandibular vein over here. The external carotid will enter from the posteromedial surface, as we said. The maxillary will leave the gland from the anteromedial surface to the infratemporal fossa. Superficial temporal artery, this one over here, will leave the gland from the upper end to reach the scalp. Within the parotid gland, the most important structure is the facial nerve, which you can see here, and the auriculotemporal nerve. This auriculotemporal nerve is important to gland. As we'll see, it carries the parasympathetic secretory motor fibers to the parotid gland. That is the auriculotemporal. And then the facial nerve, the trunk of the facial nerve, with its 5 terminal branches, which are the temporal, the zygomatic, the buccal, here 2 things, the marginal mandibular branch, and the cervical branch. That's one of the most important contents of the gland during surgery. You will try your best to avoid injury of that nerve during surgery on that gland. Other structures which can be seen after removal of the parotid gland can be seen here. That is the parotid gland, which is reflected to see the structures deep or within the gland. That is the parotid duct over here. That is again the main trunk of the facial nerve. That is the great auricular nerve, which can be superficial or sometimes within the substance of the gland. And that is the sternocleidomastoid on this side and on the diagram. And that is the retromandibular vein on the diagram and over here, as we have seen it before. Other side. Some other structures are the cervical branch of the facial nerve, the stylohyoid muscle here, the masseter muscle, the posterior belly of the gastric over here. The hypoglossal nerve will appear deep to the gland here. That is the hypoglossal nerve over here, and you have seen it over here. And the external carotid, which can be seen only in that. When it comes to the nerve supply of the gland, it is a long journey starting from the inferior salivatory nucleus in the medulla oblongata, where the parasympathetic fibers will join the glossopharyngeal nerve to come out from the jugular foramen. Within the jugular foramen, it will give the tympanic branch, which pass through the tympanic canaliculus to reach the middle ear cavity, where it will share in a plexus, call it tympanic plexus, on the medial wall of the middle ear. Out of that plexus will come a nerve, which is the lesser petrosal, will reach the cranial cavity through the vitreotemporal bone, and then to leave the cranial cavity through the foramen ovale to relay in the otic ganglia. The postganglionic fibers of the otic ganglia will be carried by the auriculotemporal nerve to reach the parotid gland. There is a saying, all the glands in the head and neck are supplied by the facial nerve, all of them, submandibular, sublingual, palatine glands, lingual glands, pharyngeal glands, and most important, nasal glands. All of them are supplied by the facial, except the parotid, which is supplied by glossopharyngeal nerve. Thank you.